Good evening, everyone. This is Dr. Schilling from Sequoia Health, bringing this week's Wednesday Wellness Minutes. And in honor of this month being Heart Health Month, we're going to talk about your heart. But we're going to take a little different spin on it. And most people are unaware of this aspect of your heart health and how it can be adversely affected. We're going to elaborate on that. Happy Valentine's Day to all of you out there celebrating the day of friendship and love. That's what they call it in Mexico, at least. That'll be inclusive for everyone. So we hope this is inclusive and helps you feel better about your health and be more empowered. There are hidden challenges to the heart, and it's not just the heart itself. It can be affected by neurotransmitters like MSG and GABA, glutamic acid, things like that. And there are also free radicals out there that can damage the heart. So if you don't have enough antioxidants in your diet through vegetables and fruits and stuff like that, it can be damage to your heart as a result of that. Statins are another big problem because the biggest side effect of statins is muscle pain, and what's the most important muscle in your body, which is your heart. So just keep that in mind as you go forward. Where we want to go from is hidden infections, and those are, as you can see on the board, from teeth. And most people are unaware how their teeth might affect their body. What you want to appreciate is the only infection a body can't overcome on its own is a dental infection, and therefore don't assume that you're free and clear if you have a root canal, if you have a tooth pulled, and things like that. It's very important. As it pertains to the heart, what's important to understand is the wisdom teeth and the two molars in front of them are all three related to the heart and the circulatory system, and therefore any problems with those teeth, a lot of people have broken cusps, they have root canals, they have crowns, they have teeth removed. Most of us have had our wisdom teeth pulled, things like that. So keep that in mind. Those can adversely affect your heart and your circulatory system. So look at a German tooth chart and or a Chinese medicine tooth chart. It's a tongue twister if you try it, say it too many times fast. Keep that in mind. As I mentioned before, pulling a tooth, as the sign says, no tooth does not equal a solution. So you want to be aware that just because you pull a tooth after a failed root canal or something like that, you still may have problems within the jaw or in the gum tissue around there, or both. So you want to be aware of that, and that will lead you to treating the source. Treating the source would be using what's called a Medi-Dental Pack from Premier Research Labs, which we use here in the clinic. It might be using a metal detox or a metal-mineral replacement balance. We might get that from Des Bio. It just depends on what your needs are. Depends on how many heavy metals you have trapped in your body and in the tissues. So these are some important things to look at when you're understanding your heart health. Many people have heart challenges, and they're unaware of how their oral health can affect their cardiovascular health. So these are very important things to understand. We'll be expanding more upon this in our blog. They'll be coming out on Monday of next week. I just want to remind you quickly that next week we have the Patient Appreciation Week, and that we're going to be having opportunity for people to take advantage of the PEMF, different opportunities for sampling different products and having opportunities to get things, well, everybody likes less, right? So at a discount. So we're going to go with that as far as giving back to our patients, showing the love, as they say around here, and for Heart Health Month, as well as in honor of Valentine's Day, we're going to show the love next week for Patient Appreciation Week. So give a call, get on the schedule for the PEMF. Make sure you check the schedule. We're going to be sending out emails and things like that. If you don't get it in your email, check our Facebook. If you don't get an email, let us know so we can make sure to get you on the list, and or make sure it's not in your junk pile or something like that. Feel free to give us a thumbs up or send us some feedback on this, maybe interesting questions or ideas that you've encountered, and how a friend or family member might have come in contact with a bad tooth and how it dramatically impacted their life. These are very real things, and most people are unaware of it. So share it with your family and friends and make sure that they understand it so they can be healthier as well. We look forward to seeing you next week. I will be coming to you live from Florida. I'm going for an advanced Q&RT seminar, and so I'll be coming to you live from Florida next week, bring some interesting insights on how your mental emotional health can affect your physical health and how they're dramatically and inextricably intertwined. So look forward to that next week. Have a great week, and we'll see you next week for Wednesday Wellness Minutes.